Hi, it's Gautam Kulkarni. I'm a pediatric consultant in London, and today I'm going to talk about different types of cough. So, it's winter, and it's really common for children and parents to have this chronic, constant cough, which is really troublesome. But I'm going to talk about the causes of cough and what you should be aware of. But before I start, there's a particularly dangerous infection going around this time of the year, and I've already seen two children with it, and it's called whooping cough. Now, whooping cough is a really important cause of cough, which can be prevented by vaccinating yourself and your children, and it's really important to take the vaccination. The first signs of whooping cough are similar to any other infection. There could just be a mild fever, or there could just be a runny nose or a slightly sore throat. However, the cough gets worse and worse, and especially at night, there are bouts of coughing which are constant and really discomforting. The Chinese, in fact, call it the 100-day cough. Of course, the common causes of cough are simply viral infections. In children, the most important of these is something called bronchiolitis. Now, bronchiolitis affects young children and babies, but bronchiolitis can potentially cause them to get really breathless to a point that they need to go to hospital and may even need to be admitted. So what is bronchiolitis? Essentially, it's a viral infection which is caused by a particular virus called RSV, which stands for respiratory syncytial virus. However, it causes intense inflammation in the small airways of babies. As a result of this, they struggle to breathe and they struggle to feed. The two important reasons why children may need to go to hospital are A, because they really can't feed, and B, because they start breathing so rapidly and so fast that they might need supplemental oxygen. The next important cause of cough, of course, in young children is croup. Now, croup is also quite common, but thankfully lasts only for a few days. Croup can sometimes get worse the next day, so it's important if your child is struggling to breathe or very noisy to take your child to hospital and get assessed, because sometimes we might give them a course of a medicine called steroids. Now, steroids work miraculously and very quickly shrink the inflammation, and the child may be back to their normal self soon thereafter. Often enough, though, with viral infections, there can be significant inflammation in the airways of young children. And this is because physically, their airways are much smaller than those of adults. In fact, the resistance to airflow is the fourth power of the airway diameter. And so even small amounts of inflammation or mucus in the airways can significantly narrow their airways, reduce their airflow, make them really breathless, and cause them to be wheezy. And that is the reason why a lot of babies or young children can sound wheezy and get more wheezy when they have viral infections. Now, often they may not actually have asthma, and often as they get older, they might actually grow out of this wheeze, which is called viral-induced wheeze. Some children, however, may actually have asthma, and this is easier to diagnose once they are more than 4 when we can do lung function testing. However, often we see that children who are later on diagnosed to have asthma are often particularly more wheezy when they have viral infections. If your child has been diagnosed with asthma, they will be prescribed inhalers. Now, there are two main types of inhalers. The first one is called the reliever, and the reliever is something that we use right away if they start to cough or they start to get wheezy. Typically, it's blue in color and it's called salbutamol or Ventolin. The other type of inhaler is, of course, called a preventer inhaler, and these are usually steroid inhalers. Now, the reliever inhalers work right away. As soon as you give the inhaler, the child starts feeling better. The preventer inhalers, nevertheless, take quite some time to start working. Sometimes, to get peak action, it might take up to 6 weeks of the steroid inhalers to be used regularly and properly to start working. Often enough, families may feel that the steroid inhaler is not making much difference in the first few weeks, and therefore they might stop it. Now, why is it necessary, if prescribed, to also use the steroid inhaler properly? So when you have asthma, what often happens is the muscles of the airway in the lung, they can get tighter and go into spasm. Now, when we give the reliever inhaler, the spasm improves temporarily. However, they can go into spasm again. It's almost like these muscles are going to get more tone, as someone would if they were going to the gym. Hence, if you're just very infrequently needing the blue or reliever inhaler, it's fine to just use that. However, someone who has been diagnosed as having childhood asthma should ideally be prescribed the brown or the steroid inhaler to start with. And the reason for that is that the steroid inhaler will gradually reduce the inflammation of the airways and therefore help in healing. So the other cause of cough which I often see is allergies. Of course, the incidence of allergies is increasing rapidly. Some children may have a dust mite allergy, and so when they go to sleep at night, the pillows, the blankets, the mattresses, the carpets, they all have dust mites, and as a result of that, they get quite congested and they may sound quite noisy. Sometimes, as a consequence of the dust mite allergy, you may also have allergy-induced asthma. And similarly for other inhalant allergies, such as in springtime to tree pollen, in summertime to grass pollen, and in autumn to molds such as alternaria. Of course, if your child seems very unwell, has a very high fever and a cough, they may have a chest infection or a pneumonia, and it might be important to seek your GP's advice right away. And finally, I'm going to discuss another type of cough, and this is a chronic, recurrent wet cough, which often gets worse at night, where children themselves look quite happy and healthy and playful and are going to nursery regularly. They seem to be eating their food and don't seem to be particularly out of breath. Now, this condition may be chronic protracted bacterial bronchitis. Sounds like a long word, and it is, but essentially it is a low-grade infection of the airways which produces lots and lots of mucus. Now, the bacteria live quite happily underneath all this mucus, and sometimes short courses of antibiotics may actually not penetrate the mucus effectively to kill all the bacteria. These children may need a very long course of antibiotics which are specifically designed to treat this condition, and the incidence of this is unfortunately increasing. There are, of course, other rarer causes of cough, especially in young children, and these could be laryngomalacia or other airway abnormalities or even foreign bodies. We won't go into details of this now, and we won't be covering on other causes such as the flu, such as, of course, COVID. We will leave the discussion of the long COVID syndrome to another day. I hope you found this interesting, and thank you so much for listening.